Hello, hello, hello. Assalamu alaikum. Likely to discuss about this postpartum blue depression psychosis. It happens after the postpartum period. Postpartum blues is very common. Happens most of the women after giving birth of her baby. It happens within 2 to 3 days. Resolves within 14 days. Symptoms is mild depression, tearfulness, irritability. Actually, in this kind of patient, they actually need care. They actually need support of the husband and the in-laws family. This is the very common issues happen in postpartum period. The next postpartum depression. It is 8 to 15% typically within 4 to 6 weeks, can be up to a year. More than 2 weeks of moderate to severe depression, sleep or appetite disturbance, low energy, psychomotor changes, guilt, like features of all the features of MDDs. More than 2 weeks of a major depressive features, if present, if we remember all the things in a new way every time we uh, try to remember in a new way, it would be very difficult for remembering. So understanding one mnemonic or one or two mnemonic and using it different aspects of the journey would be very helpful. Like in postpartum depression, if you think about MDDs, we know that in MDDs more than 2 weeks of depression, and the mnemonic is dig space. That means depressed mood, interest lost, guilt, sleep disturbance, suicidal ideation, psychomotor agitation, psychomotor agitation, concentration loss, energy loss, suicidal ideation. These type of features present. Uh, it should be postpartum depression, and in postpartum psychosis this type of patient, but 1 to 2%, it may happen in days to weeks. Delusion, hallucination, somebody is saying to kill the baby, and there may be auditory hallucination, delusion, there may be false belief that this is not her baby, and disorganized thought, bizarre behavior. These patients should be admitted in the hospital, and if it is possible, you should give electroconvulsive therapy. In postpartum depression, first of all, try to counsel the patient. If it is if it is not improved, then you should give the drugs which helps in postpartum uh, drugs which helps in fighting with the depression. And for this type of woman, they actually um, cannot unable to sleep, for they are unable to sleep. So before giving benzos like clonazepam, diazepam, this type of benzodiazepine helps in sleeping. So you have to counsel the mom that this type of drugs can make you sleep, and this type of drug can make your baby also sleep. uh, some forms goes through the lactation, so you have to reassure the mom before giving it. And other thing that giving the other drugs, like the other drugs the other drugs like antidepressive, like SSRIs uh, should be taken uh, before taking the SSRI. Baby should breastfeed, and after breastfeeding, she should take the drugs, and up to 3 to 4 years she should not do breastfeeding. If she wants to breastfeed at that time, before taking the drugs, she can use the breast pump and eject some milk, and then in this period she can breastfeed her, she can feed her baby, because this type of drugs can goes to the uh, this type of drugs can go to the baby and cause some sort of sedative effect. So you have to counsel, this type of counseling should be done before giving this type of drugs, this type of SSRIs like sertraline, escitalopram. These type of drugs can be given. Hope you enjoyed.